It's the 10th of January 2021. I'm Lucy Rivet. I'm one of the infectious diseases and virology registrars, and I'm going to give you a brief introduction to testing of SARS-CoV-2 at CUH. There are a number of key decisions when it comes to testing for SARS-CoV-2, and these are based around who, when, and how to test. At CUH, all patients now receive testing on admission. Any results will be interpreted by the admitting team, and this will guide both the patient's management and their placement within the hospital. In addition to this, all inpatients should receive a further test on day 3 and day 7 of admission. On these days, a prompt should appear when you enter a patient's records. Please do not skip over this. It is the responsibility of the team as a whole to ensure that this is done, and this will ensure good care is provided to both the individual and the hospital as a whole. If a patient tests positive on admission, there is no necessity to repeat swabs on day 3 or day 7. Additionally, if patients are readmitted to hospital within 90 days of a previous positive test for SARS-CoV-2, they should only be retested if they develop new symptoms of COVID-19. We are all aware of the key symptoms of COVID-19, namely a new continuous cough, a temperature of more or equal to 37.8, or a loss of change in the normal sense of taste and smell. However, there is no single clinical, hematological, or biochemical feature specific to COVID-19 on its own. And as such, it's important that you consider and test for COVID-19 in patients with symptoms other than those expected. This is particularly important if a patient is short of breath, has gastrointestinal or neurological symptoms. Atypical presentations may occur, particularly in older patients, such as falls, postural hypotension, and confusion. And in general, in older people or those with cognitive impairment presenting with delirium, and where investigating any possible infection in the immunocompromised, it is always safer to consider and test. You may be unsure of which test to send. In general, we have 3 forms of testing available to us at CUH, 2 of which, the point of care test and the PHE laboratory test, are PCR-based tests, and these are used to detect the virus itself. Their principal role is to look for active infection. In addition, there are serological tests available that look for antibodies, and these are predominantly used to provide evidence of prior infection. A positive result correlates to previous exposure to SARS-CoV-2, but there is currently no evidence to show that this implies protective immunity or prevents reinfection. It is therefore not recommended for use in diagnosis. You may have heard the point of care test referred to as SAMBA testing. These tests had rapid turnaround times and are reserved for specific patients. A comprehensive list of eligible patients is available on the staff portal. In summary, though, they are reserved for high-risk admissions, and you can also request these if there is a significant clinical concern regarding new symptoms in an inpatient. They are also used for discharge purposes, but this must be discussed with a duty matron before requested. Any other purpose, such as outbreak investigation, is really at the discretion of the virologist on call. To ensure that SAMBA tests are processed quickly, please make sure you only use SAMBA swabs and SAMBA vials, and make sure that you clearly write the time of collection and whether or not the patient is symptomatic or asymptomatic on the request. PHE testing is used for pre-admission screening and for screening at day 3 and day 7 of admission. And for these tests, you need to use one flocked nasopharyngeal and one cotton-tipped throat swab, and they should be placed in the same viral transport medium. If a patient is producing sputum, please send a sputum sample in addition. All samples need to be double bagged in clear bags and clearly labeled as inpatients on the outside of the bag. When calling a porter for sample collection, please make sure that you specify that this is a COVID sample. It's important to note that the sensitivity of SARS-CoV-2 testing varies, but it is not 100%. A negative swab therefore does not rule out COVID-19. This is an important point if you have ongoing clinical suspicion in a patient. Additionally, swabs are more likely to yield a positive result early in the COVID-19 illness, and so therefore you may get a false negative later in the course. Severe cases have predominantly lower respiratory tract shedding, and therefore lower respiratory tract samples have a higher yield for SARS-CoV-2 positivity than upper respiratory tract samples in these patients. Therefore, if there is ongoing clinical suspicion, please consider retesting and discuss with the duty virologists and infection control nurse specialists regarding bed placement. One further point is that co-infection with other respiratory viruses have been described. And so the presence of a positive respiratory viral swab for another virus does not exclude COVID-19. For any further information on how to request SARS-CoV-2 tests on EPIC and links on how to interpret SARS-CoV-2 results, please refer to the COVID-19 guidelines available on the staff portal. Thank you.